I think it's important for us as dentists to know that if we are looking for qualified registered dental assistants, which there is a shortage of right now, that we have to do our part to make sure that they're trained well. Part of their mandatory training so that they're eligible for licensure and to take the examination for licensure is that they have an internship or externship experience. They cannot become a registered dental assistant without that experience. The purpose of having an intern in the office is not to have an extra set of hands or a new employee. The purpose is for the student to learn. And we want to make sure that even if they're observing, they're learning proper procedure, proper discussions, proper approaches to any given situation. And they can't do that if they're working sterilization all day long. It's good to know that the students come well prepared for their internship. They've already had their hepatitis vaccinations. They've had some pre-admittance drug testing. They've also had their CPR training. Their certifications for x-ray and sealants and coronal polishing are already taken care of, so they can actually come into the office and do those kinds of procedures. There is an agreement that the dentist has with the college that provides mutual freedom from liability for both parties. By the time a student has committed to an internship, they've already had all of their didactic courses taken care of and all their certifications are all done. So they're willing and able to commit to a full day at the office. You can have a student in the office for 8 hours at a time. They're not going to be leaving the office for going to a class or something like that. The students usually come prepared with their schedule and they tell us how many hours they need. And I'll usually either have myself or one of our team members go over our schedule with them in the next several weeks to make sure that our hours that will be open will match the hours that they need. In our office, we use a software program called EagleSoft, and it has a time clock feature. So we just add the intern to our office staff, on the listing on the staff, and they can clock in and clock out every day. That way it's an easy way to keep track of the records and make sure they're getting their proper hours. Usually we'll have them come to our first morning huddle when they walk in the first day. We introduce them to the staff, to the team members, and we want to make sure they feel a part of the team. And then I tell them just shadow someone. We assign an assistant to have them shadow for the first day or two because we want them to feel comfortable in the office. We want them to feel like they know the people there and they know the procedures and get a little more accustomed to it.
So a lot of times when they first come into an internship site, we want to introduce them to the doctor, the other assistants, the front desk, and usually their first time coming through, they have their notebook, so they're taking a lot of notes. They're not jumping right into assisting at the time. So we just have them kind of shadow us, go from operatory to operatory, and make them feel comfortable, because at the time, you're really nervous coming out of the program, and we just want to make them feel comfortable and not jump them in right away.
During that internship, they had a registered dental assistant shadow me. That way I can know what comes next. I can be able to hand the dentist the right instrument. And then they would also talk to me afterwards, after the procedure, and they would also tell me, I did this okay, or this next time, or they would just kind of tune up whatever I did.
During the orientation, we'll have the assistant show them where everything that's necessary is, including the emergency kit, the oxygen tanks. We do have procedural manuals that have pictures or photos of tray setup so they can refer to them and look them over, that type of thing. One of the most important things to do is to get a feel for how an office is, the culture of the office, the pace of the office, and just the office personnel and team members. But I always introduce the student. I say, this is Rachel. She's a student at our Allen Hancock College Dental Assisting Program, and she's learning how to do everything that our dental assistants normally do on a daily basis. And if you don't mind, she's going to sit chairside and assist me today. We will usually have them watch a few procedures, and we'll try to identify in the huddle in the morning the best patient and the best procedure. So we're looking for something simple and a pretty agreeable patient, pretty non-anxious patient, that type of thing. And so we make sure that it's going to be an easy procedure and something that they can just step right in. Now we will have our assistant present, standing chairside as well, for any help, assistance, pointing out an instrument, that type of thing. My experience, probably the the thing that they need the most help with is actually passing instruments back and forth between the dentist and the assistant. They need to get the feel for how an instrument gets passed and who has it and who's letting go and that type of thing. So I think that's the one we work on the most, and they get the suctioning and the positioning and everything later. Facets of their training in our office as well is that they move up to the front desk and learn how to do some of the other procedures that are essential to running a dental office, such as scheduling, helping patients check out, perhaps even collecting a fee at the front desk, and sometimes answering phones, confirming with patients and that type of thing. I have a student that graduated from the program 2 years ago as an RDA and is doing a great job up front.
I had some office training. They would have me answer phones, confirm with patients their appointments for the next day. They would have me, sometimes I would go through recall list, go through health histories, make sure everything's updated.
Generally, after I've finished the evaluation, I'll sit down with the student and go over what my findings are, or what I would suggest, and just let them know why they're receiving the evaluation that they are receiving.
It really helped that the dentist gave me feedback at the end of the procedure on what I did okay and what I needed to work on, and I really valued that because coming from the dentist, it helped a lot.
It's good to know that when you have a student in your office, the college supports both the student and the dental office very, very well. If there's any issues or any questions that come up, the staff is very, very responsive to any issues for both the student and the dentist. All of my team members employed with me now are all graduates of the Allen Hancock Dental Assisting Program. From RDAs to my front desk to my dental hygienist, all graduates of the program at one time or another. I think it's a wonderful opportunity for us to share our knowledge, our skills, and our wisdom. I'd say if you're like me, most of us got involved in dentistry because we want to give back to our communities and we want to do things for people. And one of the things we can do is to help pass on all the knowledge and the wisdom and the skills that we have, and help train a new generation of people that are going to be highly skilled but also highly effective in the new profession that they've chosen. And this is a wonderful way to do that.
Being placed in an internship site really helped me when I went to work in the dental field because I already had in-office training and I kind of already knew what to expect.
Any way that we can assist them to make them successful employees when they go out into the job place, it will just go great for them.